Every Wednesday, Just Kidz Emergency joins us for a discussion on the best healthcare for your child. This morning, we're talking about managing febrile convulsions or fever fits. In studio, we have Dr. Vanita Shukla, pediatric neurology specialist, who's going to be sharing with us just a little bit more. Good morning, Dr. Shukla, and welcome.
Hi, good morning. Thank you for having me.
It's a pleasure to have you with us on the show this morning. Thank you for getting up early and being with us for this conversation. Now, before we started, one of the things you were sharing is that you are recently back here. So welcome back home to the warmth.
Oh, thank you.
And hoping that you're getting that good warmth from us this morning in studio. Let's talk a little bit about the fact that you are a pediatric neurologist, because if I'm not mistaken, you're the first to come on the show. What exactly does it entail?
Okay, so with regards to being a pediatric neurologist, I do work in the public and private sector. I do a clinic at Just Kidz Emergency as well on a Monday afternoon. And what a pediatric neurologist training is that after my pediatric training, I did 2 further years in England in pediatric neurology. And I recently completed another specialization in pediatric epilepsy in Canada. So that's why I'm back here.
Interesting, and I'm glad that you brought up epilepsy, because one of the first things people think when they hear seizures and fits is epilepsy as well. Is there any relationship between fever fits and epilepsy?
So yes, that's a question we get a lot from our parents. So with regards to fever fits, so that's the Trini slang for febrile seizures, fever fits are provoked seizures. So they are seizures provoked by fever. Now, for the diagnosis of epilepsy, the patient would have to have 2 or more unprovoked seizures more than 24 hours apart.
Right.
So if your child has fever fits, it does not mean that your child has a diagnosis of epilepsy.
All right. So let's talk about fever fits, febrile seizures. Why do they occur, and are they common in children?
So it's very common in children. It's the most common seizure presentation in children. They occur in a specific age group, so from 6 months old, so as early as then, to 6 years old. And the reason for this is because, as with everything in kids, the brain is also still developing. And because of those developing brain connections, they are susceptible to the inflammatory response caused by the actual fever. And that's why fever fits occur in this specific age group.
So it's more common in children versus adults, correct?
Yes, it's not something that we see in adults.
All right, so let's talk about the what displays with a febrile seizure. What behavior will you see your child display?
So with regards to how a child would present, sometimes it may come out of the blue, right? Your child may be suffering some minor cough and cold symptoms. They might have a fever. You might try to get the fever down, but because there is sometimes a genetic predisposition to these kids having fever fits, it's something that you may not be able to prevent.
Interesting.
So, yeah, with regards to the actual seizure, there are different types of seizures. The main one that we would see is the shaking of the entire body, the stiffening and jerking of the entire body. And then sometimes it might just be one part of the body being involved. Sometimes as well, it may not show any movement signs, and you may just have a child that's staring out into space, and you can't get their attention. So those are different types of seizures that could occur.
Now, how dangerous are these seizures to children?
So good question. That's another question that we get a lot from our parents. And it's very scary for a parent to witness their child having a seizure.
Of course.
Right? But, thankfully, with fever fits, it is quite harmless. Now, with regards to the features of fever fits, what we usually see is a child presenting with a short seizure, so less than 10 to 15 minutes. Still long, but it's considered short. And the entire body would be involved, and they take a short time to recover. So within an hour, they're back to their baseline activity.
Okay.
Now, that's the majority of patients that would present with fever fits, so febrile seizures. And the main danger that occurs with any seizure, may it be febrile seizures or an afebrile seizure, is the immediate danger to the child.
Right.
So if there's any injury at the time of the event, or if the child is drooling a lot, can't control his or her secretions, or vomits during the seizure, and those contents go down the wrong way. So, the child will be at risk of breathing problems and will need further management in an emergency setting.
So you're speaking about at the present point in time, but what about the possibility of any long-term or permanent damage?
So, with regards to febrile seizures, studies have shown, they have compared children who had febrile seizures and children who never had febrile seizures, and the difference in the long-term developmental outcome is the same. So it does not affect your child's long-term development or cause permanent brain damage if managed effectively.
Okay, that's great to hear, especially with the managed effectively part. So what would you advise is the best step towards effectively managing this in your child?
Right, so 2 things: managing the fever, so managing the source of the seizure, the provocative factor. So in Trinidad, what we do, we bathe the child in cold water, we put them in front of the fan, and that's an aim to bring the fever down and cool down the peripheral body temperature. But what we are not addressing when we do that only is the increase in the core body temperature. Now, to get the core body temperature down, what we usually advise is regular paracetamol or Panadol. Could be given every 4 to 6 hours according to the instructions on your on the bottle, and making sure that your child is well hydrated during the febrile illness and wears light clothing. So that would address the fever. Now, sometimes we may not be able to prevent the inevitable.
Right.
So if your child does have a seizure at home, it's important to know about first aid management for seizures. And there are resources available out there for parents. There's actually a parent workshop available at Just Kidz Emergency.
Wonderful.
For parents who want that extra training and what to do at home in case of an emergency.
Okay, great. Now, as we're talking about this present going on to permanent, what about the possibility of ongoing? Is it that if your child presents with febrile seizures, that this is something you can expect to see happen in the future?
So that's another good question. So within the same illness, the chance of the child having another fever fit or febrile seizure would be increased if the child now has what we call complex features of the febrile seizure. So in the minority of patients, they'll have complex febrile seizure features. So that would be a longer time during the event, a longer time to recovery, and one part of the body may be involved, so what we call a focal involvement. If that occurs, the chance of the child having another febrile seizure during that same illness would be higher. Now, with subsequent illnesses and subsequent fevers, the risk of the child having a febrile seizure during another illness would be higher if there's a family history of fever fits, or you would have heard that, one of your family members had a fever fit when they were young that they grew out of. Or if the child presented at a younger age, so less than 18 months, when they first started having fever fits.
Yeah, thank you for mentioning that. I know earlier in the conversation you did mention genetic predisposition, which many times we wouldn't correlate with fever. You know what I mean? So definitely something to keep in mind. Now, you also spoke about effective management using paracetamol, but let's talk about something else that has been a hot topic. It's been a hot topic for years, but especially came up with COVID-19 as well, immunization. What's the relationship, immunization and your child with febrile fever fits?
Okay, so every child should be immunized against life-threatening illnesses and infections. Having a child who has fever fits, a recurrent febrile seizures, or a risk of febrile seizures, it does not, these are not contraindications to vaccinating your child. However, as a parent, I understand that especially if your child had a fever fit after a routine vaccination, you would be scared to vaccinate your child, right? And to those parents, I would say what I said before, manage the fever, because with febrile seizures, the risk of having a febrile seizure is usually within the first 24 hours of having the fever. And secondly, if you can't prevent it, make sure you are safe, make sure your child is safe, and that you know effective management of seizures at home.
Definitely. Now, at Just Kidz Emergency, have you seen an increase in parents bringing in children with febrile seizures?
Yes, so with the recent surge in viral illnesses that we had after COVID-19, after the pandemic, and Dr. Paul, talked about this last week, about the surge in viral illnesses that we've been seeing and the different presentations of viruses. So with febrile seizures, the most common cause of fever would be a virus in a child as the main offender. And yes, with the increase in viral illnesses that we have been seeing, especially as our children did not get a chance for their immune systems to develop as they were home during the pandemic, we have been seeing more presentations of patients with febrile seizures.
Wow. Something to keep in mind. And I'm assuming, as you mentioned, speaking to Dr. Paul last week, one of the things we discussed was, yes, we've seen an increase in viruses. We're looking at the carnival season and so much more. So this is something that we can expect to possibly see just maintain, hopefully just be on a steady pace and not necessarily increase. Now, with your years of experience, what would you say are some of the, or let's say maybe 2 critical things that need to be kept in mind when it comes to your child and febrile fits and childcare in general?
So with regards to febrile fits, manage the fever, manage the source of the fever if you can. Make sure you have a working thermometer at home. A lot of parents just, feel the, feel the skin and say, my child has a fever. But measuring the temperature is also important and recording that. And thermometers are available. Very, it's very accessible to everyone. So that's one thing. Make sure you have paracetamol, Panadol at home. Our kids have been getting sick quite frequently, especially our school-age kids, and they have been bringing home the virus to the families. And make sure that you know how to keep your child safe at home. So seizure management. Now, with regards to childcare in general, I have adopted this premise that we need to listen to our patients. Parents know their child best, and it is my job to support that family in their journey with their child and help them understand their child's illness.
Wonderful. Well, Dr. Shukla, thank you so much for being here this morning. Looking forward to having you back again soon to speak more on Just Kidz Emergency Medical and learn how we can take care of our children.
Okay, thanks for having me.
It's been a pleasure. Just Kidz Emergency Medical is located in St. Clair. Make sure that you check them out and, of course, always listen to your child. We'll be back in a few moments right here on the Now Morning Show with your birthdays.